Well, thank you for having me, everyone. My name is Alastair. I'd been mentioning to a few individuals before that back in 2007, I was at Nashville Community College as president of the Rotary Club there. So it's very cool to be here and be at a Rotary meeting. So I work as a community outreach volunteer for the HIV/HCV Resource Center. I'm also an EMT and here to talk to you today about Narcan. Just to start things off, I always like to see a raise of hands if anyone's ever administered Narcan on someone before. Okay. All right. Cool. So to start, I just want to talk about why we have Narcan and kind of what it's used for. So when someone uses an opioid such as heroin, it gives them a euphoric effect. What it also does to the body is it slows your breathing and it slows your heart rate. And at high enough concentrations or with enough of using an opioid, it can cause your breathing to stop and then your heart to stop. And that's why we have Narcan, is it reverses that process. And the whole idea is we're trying to keep people from transitioning from what they call respiratory arrest, from when they stop breathing, to cardiac arrest. Their heart stops. And what they call out of hospital cardiac arrest, when someone has that, when they're not in a hospital setting, the survival rates are very low, anywhere from 11 to 18%. So that's why it's really essential to have Narcan to be able to reverse that process and to keep people breathing, keep their heart pumping, keep them alive. So that's how Narcan came to be. It's known as medication named naloxone, and it's available in a form that we'll see today that you inject into someone's nose, and it's also available in an injectable form that you as kind of people just in the community probably wouldn't use. So, question? Yeah.
How much time is there between when you stop breathing and your heart stops beating?
Yeah, good question. That's kind of multifactorial. I think it depends on, again, the concentration of the substance that someone's used, their age. It's hard to judge 100% of when that transition from respiratory arrest to cardiac arrest takes place. I think it could take minutes. Yeah, it could be minutes. It depends, again, on the factors that you're dealing with there. But it's a quick process, and again, that's why it's so important to be able to identify the signs of an overdose, which we're going to talk about next, know how to administer Narcan, and the biggest factor, calling 911, right? Because if someone is in cardiac arrest, their chances of survival are very low. So you want to get them to the hospital, to the care that can handle someone dealing with that situation. So for the signs of an overdose, there's a few different ones you want to look for. So you can approach someone, you're going to see them, they might have cool, clammy skin, they might have a very limp body. If you're able to look at their eyes, they'll have pinpoint pupils, so very, very small pupils. You can look at their lips and their fingernails. Because it slows down your heart rate, your blood is not circulating as effectively through your body, so you can have blue fingernails, blue lips as well. And the other two big ones to look for are they responsive and are they breathing? So those are the really ones. Take that into account, but again, are they responsive and are they breathing? And those are the main kind of factors that you want to take into consideration if you have Narcan and approach someone who you think might be overdosing. And let's walk through the steps of kind of assessing someone and administering Narcan. So I like to break it down into really 4 easy steps to follow. So 1, you're going to check them. And this is this idea of, are they responsive? And so you come up to someone, they might look like they're asleep, they might have they can sometimes have a gurgling breathing sound. A great way to check that is called a sternum rub. So you take your knuckles on your hand, rub their sternum, and see if you get a response from them. And even if they do wake up, if they don't wake up and they're 100% alert, treat it as an overdose. When in doubt, treat it as an overdose, because it's extremely difficult to tell someone who's just used a lot of heroin is having great high or someone that's overdosing. But you want to see and just assess that responsiveness from them, and a sternum rub is a really effective way of doing that. Second, and this is the most important step here, 911. Call 911. Because again, you might be thinking someone's having an overdose. You don't know their medical history. They could be a diabetic, they could have other conditions. And again, going back to that idea of people stopping breathing, their heart stopping pumping, the best bet is to call 911, get EMS there so they can then get them to the hospital. All right? 3. We're gonna administer, sorry about my poor handwriting. So you're gonna administer the Narcan. So I'm gonna come and pass these around quickly on both ends of the room. You mind if I squeeze by you? So these are kind of dummy Narcans, but I think it's really, it's good to get hands-on with them so you can kind of feel what it's like to press down the applicator, which is used to administer the Narcan there. It is, it's very simple. So what you're gonna do after you've checked someone, you've called 911, even if you can put your phone on speakerphone or have someone else call 911, that's great too. Next step is administering Narcan. So you're gonna take that right there and you're gonna insert it into someone's nose, press down, and that's gonna spray that medication into their nose, and that's very quick. So to see an effect, you're gonna be looking at 2 to 3 minutes. Someone should respond. And if they haven't responded in 2 to 3 minutes, feel free to administer another dose if you have it with you.
Is this a single dose?
That's a single dose.
More than...
One dose. So you would press that applicator in someone's nose, dispense the medication. That is no longer viable to use. It's been used. So you're going to administer the Narcan. The next step is...
Excuse me, the same
yes.
nostril or a different nostril?
You could do the same one, different one. Sometimes you want to look, is the same one, different one. Don't overcomplicate it. Use that into the same one. Or if for some reason you think there's something built up in there, maybe change it, but don't put too much pressure on yourself. Keep it simple. Just administer it, wait 2 to 3 minutes, and then administer another dose.
So if they're not breathing, it doesn't matter? Does it get absorbed through the...
It will, yeah. So it's in that mucosa, that medication is going to be able to be absorbed through the skin into the body, even if they're not breathing. So that's the great part of it, is you can administer it. Someone's not breathing, it's going to be absorbed into the body. All right? Step 4 is the recovery position. And that's just a term for putting someone on their side with their head on their side, okay? So laying them down on the side like they're sleeping, head turned, and that's in case someone vomits. You don't want them to obstruct their airway if they vomit. So put them on their side. And then the final step is support. You're going to want to stay with someone until EMS arrives, and they could come up and be really confused. They could be it could be jarring for them to go through that experience. So tell them what's happened, let them know that you've given Narcan, let them know that EMS is on their way, and try to encourage them to wait for EMS to come. And this is go ahead.
I've heard they can be violent.
So I think overall, I think that's more of a stereotype stigma than actuality. So you're going to hear EMS people who have experienced people who come out, they're Narcan, and they have a volatile reaction. That's the exception. That's not a rule. So I don't approach it like, I'm going to administer this Narcan, someone's going to become violent. I think that's not 100% factual. Could it happen? Yes. But it's not the common thing to happen afterwards. Another important thing to remember about Narcan is it has a limited duration of action, meaning it only lasts a certain amount of time. So what happens is, again, throughout your body, you have these opioid receptors, right? And heroin loves to get on there, and that's what slows down your heart rate, slows down your heart. Narcan loves those receptors more than heroin, so it knocks them off, and that's what allows someone to start breathing again. Their respiratory rate normalizes. However, that can last, and you'll see different numbers, 30 to 90 minutes. That's why it's really important to get someone to the hospital as well, because they can come out of it, you can knock off that heroin off the receptors, person's feeling good, and then they can actually start to overdose again. So that's why it's super important to make sure you encourage this individual to go to the hospital. And yeah, that's really the simple process. And I think with this is to keep it as simple as possible for yourself. What I'm teaching you mirrors the CDC guidelines, and some other people would suggest, and I think it's a prudent move, if you're trained in BLS, basic life-saving training. So you could use that. Like if you want to assess for someone if they have a pulse, if they're breathing, if they're pulseless and you have training, you want to definitely immediately begin CPR. But if you don't have training, don't concern yourself with trying to open an airway, do rescue breathing. You've done your job by calling 911 and administering Narcan, and that's the biggest takeaway.
Question, can you do harm with this, for example, if someone's having a situation that's not an overdose, say they're having a seizure or a heart attack, and you're not trained to know the difference, can you?
But you're concerned you try the Narcan anyway, just in case.
So great question. The risks associated with administering Narcan are extremely low. It's a well-tolerated medication. It's been well-tested across different demographics. So it's an extremely low-risk medication to use. And to also remember, in Vermont and New Hampshire, you're protected for the most part by Good Samaritan laws as well. So if someone, say, is a diabetic and they have low blood sugar and they pass out and you Narcan them, it's not, the chances of something happening like an allergic reaction are extremely, extremely low. It's a very well-tested, well-researched medication that has very limited side effects. So I think that's a peace of mind to have, that A, you're protected by Good Samaritan laws, and B, this medication is tried and tested. It has very limited risk profile when it comes to using it on individuals. Yeah.
You mentioned heroin. What about fentanyl? Same effect?
Same effect. So same type of deal in the body with how it connects to those receptors, how it's going to decrease someone's breathing, slow their heart rate. It's just a much stronger concentration. Therefore, those effects can happen quicker, and it can require more Narcan to knock it off those receptors. So think about it as fentanyl really loves those receptors, and it might take more Narcan to knock that fentanyl off the receptors to momentarily reverse that overdose. Yeah.
Does this product have an expiration date?
It does. That's actually a great question. So we could see what the expiration date is or where you would locate it. And I can send out the information about the exact expiration date on it, but this will all be within the expiration date, what we're giving you. And there are some factors temperature-wise, too cold, too hot can affect it, but either way, when in doubt, to still administer. Call 911, still administer, and yeah, even if it's expired, I think you should still administer it. There's very little reason not to administer, even if it is expired. Yeah.
There's very few places in Ludlow where this is currently available. Why do you think that is?
Yeah, it's a good question. I think that, so I do this because of the public health benefit. I'm also in recovery, but I think there's just a real public health benefit to this, and I would like to see this medication be treated as AEDs for someone having a heart attack. I think we're right now at the numbers, it's a crisis and it needs to be that accepted. I just think there's a certain level of stigma that comes with individuals' perception of individuals who use drugs, right? We think we have a moral objection to it, and therefore that moral objection colors our openness to embrace a medication that could save someone's life. So yeah, I think it's stigma. I think it's a lack of understanding as well in education.
So we got to get the word out. Is it the health department, Vermont Health Department will supply this for free if you ask for it? You know anything about that?
I could get you that information. I want to verify that. Yeah, I could find that out for you. Right. No, I could find out that information for you and send that to Melanie if she could get that to everyone. Yeah, cool.
Absolutely.
Yeah.
So are overdoses, is it partly, I have two questions. Is it
Sure.
partly related to the quality of the street drug?
That could be a factor for sure, and that happens to individuals. And that's where that fentanyl component comes in, where you get a bag, you're used to a certain amount that you can tolerate, and then when there's another substance in that, it's more than you can tolerate, and that's sometimes what leads to an overdose. Another factor is people might have abstained for a certain amount of time, they haven't been using, and they come back and use an amount where their tolerance level isn't as high, and that can lead to an overdose as well for sure.
Do overdoses sometimes happen in like groups of people? Does it happen that way, or is it usually just one person at a time?
So there's kind of a saying, never use alone. So you would hope that people are using in groups, they have Narcan, and they're kind of giving themselves a little bit of a safety buffer there. But the truth is people do use alone, and people do unfortunately overdose and die alone. And I think that's a very sad element, and that's why, again, we try to promote using in groups, using with someone else, having Narcan with you. And I personally, again, going back to your question, it's like you have to remove kind of that moral lens you're looking at through. And it's like people are going to use these drugs no matter what you do. The drug war has been fought, drugs won. And it's time to start embracing, like, we need to implement this. And again, that's why making it more readily available, removing some of the stigma. Like, you could have people like me where you're like, oh man, he had an addiction, and is my life valuable? I would like to think so, and I like to think that regardless of your moral standpoint, these lives are valuable, and that's why we need to get Narcan out, allow people to use in groups, and to equip them to overcome this issue.
Did you just say something about safe use places? Is that?
No, I mean, I think we're far away from ever embracing safe consumption sites, although I think there's some evidence to support that they're beneficial. I'm more talking about just making it readily available so people can get it and have it on them with the people they socialize with. And some people like to go to bars and drink, and there are groups of citizens here who also might like to use heroin. That's just the fact of the matter, yeah.
So I just want to clarify, it's any kind of drug use?
For the Narcan?
For the Narcan?
No,
Doesn't matter.
Only opioids.
Only opioids?
Yeah, and that goes back to, you have those opioid receptors all throughout your body, and this medication is designed, it's called, like, if you like medical terms, like a binding affinity. It has a very strong, heroin binds to those receptors. This medication can knock off the heroin from the receptors and reverse that effect. But it won't, so say someone has used a lot of cocaine and you give them Narcan, it's not going to do anything. Yeah, so it's only opioids. Yeah.
Okay, for us who are ignorant, okay, what would be the list of opioids? Cocaine, heroin?
No. Heroin, heroin, morphine, fentanyl, those classes of medications.
How would we know what they...
You wouldn't, and that's the whole, and you wouldn't know if they've even taken a drug. Maybe they have, you give them, you call 911, you give them the Narcan, you put them in the recovery position, and you stay with them until EMS arrives. You don't even need to know. Yeah, you could say, oh, you could be like, you don't have to take it, keep it super simple. This is the best thing about this, is it can be kept very simple for you, and it makes you a great responsible citizen. You can call 911, administer a very safe medication to someone, stay with them, and potentially save their life. I think that's a win-win, so yeah.
Do you have any statistics about what happens when Narcan is available, and what does that do to overdoses?
Yeah, I could definitely get those.
I think that's in the Rotary magazine, isn't it?
Yeah, and I could get you the research on that. I mean, I think it's the evidence shows that availability of Narcan definitely decreases the amount of overdoses. If you look in Nashua and Manchester, where we've seen a decrease in the numbers, I like to think that's because of harm reduction efforts and getting this out there and educating the public more. And if you're someone who's kind of morally on the fence about that still, it's totally understandable. There's a cost associated with this as well. So there's a burden that's placed on the state when you have people going to the hospital for these issues, and there's costs associated with that. And if you're able to reduce those issues, there's a benefit through that lens as well, if that helps you kind of digest this a little bit easier if you're kind of still a little on the fence morally, which is completely understandable. So, yeah.
Can you talk a little bit about, there's a story in the news right around the Super Bowl where a couple of people were at a party and they had used cocaine that was laced with fentanyl.
Okay.
I'm not sure if you're familiar with that story, but what happened is the 3 people who had used it they didn't know it was in there. They thought they were doing cocaine and it was laced with fentanyl, so they ended up overdosing.
Yeah.
But nobody would have known because they didn't have, that wasn't their intention. It
Right.
was just that the drug was laced with an opioid.
Yeah, and I think that's kind of the scary situation right now with the fentanyl issue finding its way into different substances. And it's even more of a reason for people to carry Narcan, where someone's using cocaine, they should probably still have Narcan with them. And that, to go back to your question, is like, oh, they were using coke, but you can't, you're not going to be able to break down. You don't know. You never know. I mean,
It would help offset the fentanyl.
it would stop. So cocaine's going to have a different effect on the body, but if it's laced with fentanyl, there's still, and there could be an interaction that's maybe amplifies it, but that's kind of beyond my scope. But the fentanyl being in the cocaine is still going to have those effects where you could have someone, again, stop breathing, heart stops, chances of them surviving out of hospital, extremely low. So that's, again, hit them when in doubt. It can be really simple. You 911, take out your phone, spray them, and that's really doing a great service to that individual. So, yeah.
I got my question.
Sorry.
So like in 6th grade, when the police department came to the elementary school and told us about drugs, and the image back then was that opiate users, were in an abandoned building in New York City shooting up. They didn't have this product. Why now? Why not then? What do you know about the history of the development?
Yeah, that's actually a good question about exactly when Narcan came to market. And I, again, would be happy to find like good answers for that and we could pass that on to you. But, you have to think of the use of opioids is in a medical setting as well too. And so you always want to have an antidote, which is what this is, that can reverse a poison. And in medical settings, you want that too. You can have that. And in terms of when this started being used regularly, I mean, you could probably weigh in on this.
I can say when I worked for the court system, probably about 10 years ago, I brought it into my office and we were told you cannot have it in your office because nobody knew what it would do. And we finally were like, well, if you look at it, it's essentially harmless for people that don't need it. And that was where the shift kind of came where, oh, okay, we understand. And just like you said, in a medical setting, sometimes the person administering the opioid doesn't know the tolerance level or how the person is going to react. So they've had things such as this for a long time.
Yeah, especially like in an EMS setting too. It's multifactorial, but this has now become where it's kind of a social tool as well as a medical tool as well, which is, I think, great. Yeah.
Rather than just shouting out the questions, if you raise your hand, which this gentleman has twice, you should be called on rather. So if you have a question, raise your hand.
Sorry.
First, a personal question.
Yeah.
Have you ever experienced the administration of the Narcan?
I have Narcan myself, not because I was overdosing, but because I wanted to actually use it, and I've used it on people as well. But I've Narcan myself just because, I don't know, I was just curious to see what that process would be like.
And if you successfully use Narcan with someone, what's the percentage of people that are dead anyway in 30 days?
So we know a lot of good statistical questions. We know that people who've overdosed once are more likely to overdose again. I'm not sure, and again, these are great points of data that I can get and pass on. So your question is how many people who have been Narcaned are dead because of an overdose within 30 days?
Actually, it's a little different. It's if they don't use, do they end up dead in 30 days because of this experience?
No, I'm not 100% clear on your question. So are they dying as a result of the Narcan, or?
That's a good question.
I would.
But I'm under the impression that a certain percentage of people who are successfully brought back to life end up dying in 30 days. anyway, 30 days later. So there's an after effect on the body and the brain, and they end up dead.
I'm not sure where you got that information. I'd be interested to take a look at it, but
Sure.
I could, I would say, looking at the research, that people are not dying as a result.
See, that's not related, that doesn't occur related to Narcan, to the best of my knowledge, but it does relate to bringing them back to life using the basic life-saving techniques. You know, where you do compressions on the chest, etc.
Yeah, so I think we might be circling back to the idea of someone goes into cardiac arrest and then is revived. So again, the numbers for people who, the survival rate of people who go into cardiac arrest outside of the hospital, depending on the research you look at, is 11 to 18%. And that's if you go into cardiac arrest because you have an underlying medical condition or because of using a substance like heroin. That is true. The survivability of that is extremely low. And that's, again, why we go back to the importance of calling 911. Does that somewhat answer your question, or?
Well, actually, not quite.
Okay.
Because that's assuming they don't use or overuse or overdose, etc. But I'm assuming they didn't overdose, so you brought them back to life. And they're fine, but then they end up dying in 30 days from a heart attack or to stop breathing. Or, there's a death rate after you bring people back to life. The question I'm asking, I guess, is if you bring them back to life with Narcan successfully, if you look at these people in 30 days and they haven't used and they're, assuming you could know that, are they still alive?
So I think the bringing back to life doesn't really accurately describe what happens when you use Narcan, because someone is still alive. Their heart is still pumping. Their breathing has slowed down, and they might be getting to the point where they're going to transition from, again, that not breathing to their heart stopping. So and then Narcan will reverse that. However, if someone goes into cardiac arrest as a result of using heroin or an opioid, Narcan's not going to do anything. Narcan will not get their heart to start pumping again. So there could be some literature about an association between some complications, a certain time frame after someone has been Narcaned. I haven't seen it, but I mean, I could give you my email address. I'd be happy to take a look at it.
Yeah, do you have a card?
I don't, but I can write that down.
I can send out.
Yeah, so.
I hate to cut this off.
No, for sure.
We're over time. Is
Okay.
there anything you need to do just to wrap up?
No, we can wrap it up. Up here's Narcan for everyone. If you would like to grab some, feel free to grab some to have on you, and appreciate everyone's time. Cool, thank you.